Much, Dr. Beulah. It was such a pleasure seeing you again. I really wish I could be there in person, but this is still a miracle of modern technology that I can still join you all the way here from Texas. Thank you, and a warm welcome to everybody who's made the effort to join me today. Our topic, as Dr. Beulah said, is adapting to a new normal amidst COVID-19. So in order to adapt to a new normal, we first need to believe that a new normal is actually possible. And in order to do that, we need to change our perspective with regards to this virus. So today I am going to show you how to change your perspective on this virus using a technique from psychology called CBT. And CBT stands for cognitive behavioral therapy. It's not important that you know what that stands for, but it is important to know what the principles are behind it. The concept is very simple, but very powerful. And I use CBT almost on a day-to-day basis in my life without even realizing that I'm doing that. So I'm going to try to share some slides here about CBT, and let's see how this works. All right. Do you all see that slide there? Can somebody just give me a feedback?
Yes, ma'am.
Wonderful, wonderful. So here is just the very, very simple graphic here, which is called the CBT cognitive triad. On top, you see the thoughts, and which are then affecting feelings, which in turn affect the behaviors. So our thoughts, especially in a difficult situation, are affected by many things. You know, it may be based on what you hear on the news. It may be something that you read on WhatsApp. It may be something that you watch on TV that will affect your thoughts, and usually negatively. And when you have negative thoughts, then you end up with negative feelings, and negative feelings then end up in negative behaviors. I think I'm hearing some background static. Can you all hear me?
Sophia, there's some noise.
Yes, there's a background noise. I think everyone should mute their audio.
All right, it's gone now. Yeah, perfect. So I want you to kind of keep this very simple graphic in your mind as we go forward, because this is central to what we're going to talk about today. So basically what we're going to see is, oh, I lost my thought of concentration here. Give me a second, which I get back. Yeah. So here we have negative thoughts, which lead to negative feelings and negative behavior. So this can become a real vicious cycle, and we need to break this cycle. So in order to break the cycle, the first thing that we need to do is to change our thoughts. So today we're going to learn how to change our thoughts with respect to the virus. Let me see if I can bring myself back in here. All right. So what I want to talk about is how we can view the same data with two different lenses, one through a negative lens and other through a positive lens. And when we're able to change that perspective, we can change our thoughts, which can then change our feelings, and which can then change our behaviors. So let's consider one simple piece of data. There have been 13 lakh cases of COVID-19 in India so far. So the thought is, oh, that is a very serious condition. We are being overtaken by the virus. Many people will die. I might die. Maybe somebody I love might die. So you see how this process of really negative thoughts get into your head by one piece of data, which is 13 lakh people in India having cases. But I'm going to show now, if we can show you how we can look at the same data from a different perspective by looking at other things at the same time. So for example, I'm trying to switch between slides and presentation here. So let's look at this graphic here, and this is about deaths. So we talked about 13 lakh cases, but there were only 30,000 deaths. So already we have sort of a relative importance. 13 lakh cases, 30,000 deaths. And look at the way this graph is going, relatively very slow slope. So one person may look at it and say, well, this is not going very steeply. For example, we can look at the graph in Italy. And if you compare that, you see that the graph just took off exponentially at a very high rate. And so we can look at it and say, well, we should be happy that we are not having this exponential growth in India. And so we're not overwhelming our hospitals. So that is one way to look at that. So one of the reasons for why there's this far fewer deaths compared to cases is because of the way this virus behaves. 80% of people that get this virus have no symptoms at all. And the remaining 20%, most of them have very, very mild symptoms, just like a cold or a flu, fevers, chills, body aches, cough, and that kind of thing. And then only a very small percentage of people end up with difficulty breathing, chest pain, blood clots, and have to be hospitalized. And then they get severely ill and then die. So we need to keep that in mind always, this perspective about what is happening to everybody. Deaths have almost gone down to zero in many countries that were having huge surges. Now in Italy, Spain, France, China, and the United Kingdom, the deaths are almost down to zero. So we can hope now that once India reaches its peak, once the US reaches its peak, that we will also experience what these countries are now experiencing. So in India right now, we have 13 lakh cases of COVID, 30,000 deaths. That means the case fatality rate is about 2.3%. Case fatality rate is a ratio of the number of deaths to the number of cases. But the number of cases is not really a true number of cases because we're not testing everybody. So right now, all over the world, we're doing antibody testing. And from the antibody testing, we're finding out that the true number of cases is actually 10 times higher. So the denominator, if you increase that by 10 times, the actual case fatality rate is probably going to be closer to 0.2% or 0.3% because there's so many people that have no symptoms and they don't get tested. Now let's just compare that, 0.2 to 0.3% to measles. Everybody there is aware of measles. Measles case fatality rate is 15%. That is 75 times higher than what we think COVID-19 is going to be. And 25% of people with measles end up with neurological problems. Compare that to TB. Right now, TB, 4 lakh people die every year in India from TB. And so in comparison, 30,000 people is not so much. Obviously, we don't want 30,000 people to die, but we have to see, well, what is this in relation to other things that we're facing today? And another way to look at it from a different perspective is compare it to another country. The case fatality rate in India or in the United States is 1.5 times higher with all our money and all our facilities and everything. And that's because, unfortunately, we have a more obese population, a more unhealthy population, and we also have an older population compared to India. Let me go back here. I want to talk to you a little bit. Okay. So how bad are things in the US really? My parents are terrified for me. Well, in India, we have had 4 million cases, which is 4 million, I think that's 40 lakh cases. And we've had 145,000 deaths, which is quite a bit. But the case fatality rate is about 3.6%. But the true case fatality rate is really 10 times lower, so it's 0.3%. So compared to that with the flu, which we have every year that we've learned to live with, every winter we have the flu, and the case fatality rate for the flu is 0.1%. So is the COVID-19 very serious? Yes, it is very serious. It is at least 3 or 4 times as bad as the flu, but it's not the worst thing that we have seen. Compared to May, our cases have increased, exploded, but actually our number of deaths are going down from our peak of, I think it was 22,700 cases per day in May. It was 2,700 deaths in May. Now we're down to about 300, 400. We're seeing again a little peak, again the second peak, but we're overall a lot better now than we were 3 or 4 months ago. The reason we're seeing more cases now is that the younger people are going out, the lower risk people are going out, going to their jobs, interacting more with their families, but they're not dying as much because they are younger. The biggest risk factor here is age. And when young people are going out, they're at low risk. And the ones that are dying are young people that are not healthy. Either they have obesity, or they have diabetes, or they have high blood pressure or heart disease or something like that, that is causing them to get really sick and die. So another piece of good news that I want to share with you is about children. Most of the time, excuse me, I'm taking a drink there. Most of the time, these infections greatly affect children. Measles, pneumonia, flu, diphtheria, all of these things affect children. But in this case, fortunately, the children have been largely spared. Out of 7.4 crore children in the United States, only 30 have died. And I was not even able to find any data on children's death in India. So few have died all over the world. There have been 0 children's deaths in Texas, New York, and California, which have been the hardest hit states in our country. And in Florida, where they had 22,000 childhood cases, only 4 children died. So compare this, we have 30 children dying of COVID-19 in the United States. And during that same time, we had 100 deaths from the flu. So more than 3 times the children died from flu than from COVID in the US this year. And we already have a vaccine for the flu, and we already have a treatment for the flu. In India, for example, pneumonia deaths in children, just less than 5 years old. We're not talking about all children, less than 5 years old. 13 lakh children die every year. Pneumonia kills 14 children per hour in India, according to the UNICEF report in 2019. And then worldwide, 1.4 lakh children die from measles every year. So this is, let us be really thankful that the COVID-19 has spared our children, and what a blessing it has been to us indeed. So I hope I've been able to reframe your thoughts. So is COVID-19 serious? Absolutely serious. Should we protect ourselves and our high-risk people, our elderly people, our sick people from this disease? Absolutely. And do we need to take measures to reduce the spread of this disease in our community by social distancing or keeping apart, by hand washing, by wearing our masks? Absolutely. But is this the worst thing that has happened to us? Or is this the worst thing that is currently happening to us? Absolutely not. So let's go forward with a new frame of mind, with a new perspective. And I want to talk about some of the positive things that have been happening around this COVID-19. First of all is the treatment. So normally it takes years for treatments for drugs to be discovered, for treatments to be determined. But even within just 4 months, we now know how to treat COVID-19 a lot better in the hospital, especially the seriously sick people. And that's why we're having a lower death rate in the hospital right now. We know how to give oxygen to people, how much oxygen to give them, when to start oxygen. We know now about ventilators. Ventilators are breathing machines. We now know how late to start it or how soon to start it. What are the settings? We also know how much IV drips to give. Are we supposed to give a lot or less? We have figured that out. And we also now know that the really sick people in the hospital are needing blood thinners because COVID-19 is causing blood clots. We also have randomized controlled trials already, and which have shown that steroids and inhaled interferon beta, these are 2 anti-inflammatory drugs, that is drugs that reduce the inflammation in our body. These are being shown to be useful in critical and hospitalized patients. So it's important to realize that these are for hospitalized patients. It's not for you to be running out and getting these medications and taking them at home thinking that this will help you. I want to make it very clear. These are for hospitalized patients, patients that are going to be put on a breathing machine. There's another drug called remdesivir that was originally approved for Ebola, and that's been shown to be effective in reducing the time in hospital for critically ill people. Another thing is convalescent plasma. So what is that? That is when a person who has COVID-19 recovers, they have developed antibodies in their blood, and you take those antibodies in their blood and then you give it to somebody who is really sick from the disease. Now, the studies are mixed on that, so we're still not sure how well this convalescent plasma is working, but definitely very hopeful thing in the future. One thing that has not shown a whole lot of benefit at this point is hydroxychloroquine, which initially there was a lot of hope in. But this is how science works. You come up with something, you have a good idea based on what we know, and we hope that will benefit. But when we do the studies, sometimes we find out that they don't work. So as of this point, we don't have any specific drug for the virus, but the supercomputers are screening 8,000 drugs, different drugs, and 76 of them have been identified as potential drugs for coronavirus. And the entire world is working on this. So one thing to be very clear about again is all these treatments are for critically ill, hospitalized people. We do not have any preventive or early use medicine. And the reason being it is you have to be very, very careful with this because 80% of people have no problems whatsoever. So you have to be careful that you don't give them a drug that actually causes them more harm than good. For example, in Iran, several people died when they bought into a fake preventive medicine and they took this thinking that it will prevent them from getting coronavirus, and a whole bunch of them died. And these are people that would have probably not even gotten sick if they got infected with the coronavirus. So be very, very careful. Not only you, but the medical community is going to be very careful about not doing harm to people, because this is a drug that disease that barely affects, 80% of people don't even know they have it. So we can't cause them harm by giving them a drug to prevent problems. Now, there are a couple of things that people keep asking me about. One is vitamin D and the other is zinc. I think these are circulating a lot in social media, and there's some evidence for this in the past, nothing specific with the coronavirus that has been proven, but vitamin D and zinc are involved in immunity. But you don't want to overdo this. Just because something is good in small quantities, it doesn't mean that it's great in large quantities. Vitamin D, especially because we all are dark in India, and now if we're all in lockdown and sitting at home, we may not be getting enough vitamin D from the sun. So this is one of those things that you may consider taking vitamin D, but only 400 to 800 units, not more than that. Be careful with zinc. If you have kidney problems, you don't want to take it. None of these prevent you from getting the virus. They've been shown in the past that like zinc will reduce the number of days you have cold symptoms. So how much is it really going to help? We don't know. So be very careful about using unapproved drugs, whether they are Western or herbal or Eastern. Just don't take them. We need to have proper trials before we can take these drugs. We don't want to harm people without treatment, because remember when hydroxychloroquine first started coming out and everybody started running out, even in India and here, stockpiling hydroxychloroquine, and people started taking it wrong doses, and some people died from heart problems. So we need to be very, very careful with treatments, unproven treatments. The next thing is about vaccines. Another thing that is just amazing, because normally it takes 7 to 10 years to bring a vaccine to the market. And with COVID-19, the vaccine was developed and started testing in humans within 4 months of knowing the viral genome. I mean, it is just astounding. Currently, we have 140 vaccines that are in development, and 30 of these are already in human trials, and 3 are in large-scale human trials. Right now, we even have results from 3 small phase 1 trials in healthy young adults that are less than 55 years old, and we are seeing positive results. Of course, this is just early phase 1 trials. A lot can happen between phase 1 and when the vaccine actually comes to market, but still, we can be hopeful that these are showing positive results. And the three vaccines were Moderna from the US, AstraZeneca, Oxford from the United Kingdom, and Sinovac from China. And they're all going to be starting phase 3 trials very, very soon. Now, the things that we don't know about vaccines is how long are these vaccines going to be good for? Is it going to be like the flu vaccine that we have to get every year? Do we have to get multiple shots? Will the older people need more shots than the younger shots? Are the older people going to show a response? Because if you notice in the phase 1 trial, there were no older people, nobody older than 55. And the high-risk people are really the people that need it the most, are people older than 55 and people who have health problems. And right now, those vaccines have not been checked on those people. So we have to wait for the larger phase 3 trials to answer some of these questions. So I've always said that we need to hope for the best, but prepare for the worst. So the worst case scenario with vaccines is we may not have an effective vaccine for many years, but that's been the case in the past for many diseases, and we have learned to manage with that, and we will find ways to treat it. We've already found good ways to treat the really sick people. Drugs are easier to develop than vaccines. We can find new drugs, or we can reuse the drugs that we already have. So this should still be something positive for us. I'm going to get another sip here. So I want to show you something called what I call the tip of the iceberg of COVID-19. Right now, all our attention is focused on that green spot, the COVID cases, and then the tiny little red spot on top, which is the COVID death. Whereas we're not taking into account the whole big dark blue thing in the bottom, which is the economy, the education, and our overall health. So our focus is now on the wrong, it's, I don't want to say wrong thing, but it's completely focused on what is above the water, just the tip of the iceberg. What's underneath? We have mental health problems, anxiety, panic, depression, and suicide. We have fear, loneliness, and isolation from all the lockdown, from the social distancing. And then people who suffer from things like alcoholism, drug abuse, and domestic violence, those things have become a huge problem here in the United States because people are staying at home, women are more at home, children are at home. We are having a real rise in child abuse, significant amount of women and female domestic violence at home. So these are major problems that we're going to see consequences of later down the road. Another big issue with children is because of the pandemic, parents have not been taking their children to go get their routine vaccines that we know are proven to save the lives of children. So hundreds of thousands of fewer children are going to have fewer vaccines for mumps, measles, and hepatitis. And we already know that measles is 75 times more lethal than COVID-19. What about adults? Normally here in the United States, women would be going to get their mammograms. All of us would be going to get our colonoscopies for colon cancer and mammograms to prevent breast cancer. We would be going to our doctors for checkups for our hearts, for our diabetes. But none of that is happening. So there's a real concern that down the road, we're going to see more people with heart attacks and strokes, more people with breast cancer and colon cancer. And these people are being forgotten while we're putting all our focus on that tiny, tiny little red spot on the top of the pyramid. Another big thing is pneumonia, which is a huge killer all over the world. And we have an excellent vaccine for that. And there are adults not getting their pneumonia vaccine on time. So we're really worried with the winter coming that we may not be ready to deal with both the pneumonia and flu and COVID all at the same time. So let's recap and look at the data through a new lens of hope. So the case fatality rate for COVID-19 is not as bad as we thought initially. it's going to end up being about 0.2 to 0.3% in India and maybe around 0.3, 0.4% here in the United States. The cases are rising, but the number of deaths are slowly decreasing. Fewer people are now dying in many, many countries that have gone through this pandemic already. Of course, in places like India and Brazil, cases are rising and deaths are rising, but we're hoping that that's going to be the upslope, and soon there will be a downslope, just like we saw in those other countries like Italy and Spain. We have found out this is not the worst things that has happened to us. It is not the worst thing that's happening to us. Children are being largely spared. Treatments are being rapidly discovered. Vaccine development is at unprecedented levels. And the entire world is collaborating using modern technology. So things are really not as bad as what the media wants you to believe. So let us just go back once more to my slide here. And I want to remind you again of the CBT triad. And I want to see if our new perspective is now leading us to positive thoughts. And have we changed our perspective to now where we are talking about changed feelings? So instead of having fear, anxiety, worry, sadness, and despair, I'm hoping that now our feelings will be positive feelings, belief that things will improve, confidence that we will get through this, and hope that most of us will come through this safe and sound. All right, the sharing thing. Let's see. There we go. So changed feelings can then transfer to changed behaviors, because that's really the step. Those are the steps that we need to go through in order to change our behaviors. So now we can say, now that we're no longer in fear, we can say, yes, we can manage that. We have the confidence and we can take steps to take control of certain things in our lives. We can learn to live with this the way we have lived with TB, with malaria, with flu, with pneumonia. And we need to learn how to live with this while the scientists are trying to figure out how to treat it and how to eradicate it. We need to do our part to prevent the spread, like staying away from people as much as we can. That's easier said than done, especially in India, but we need to make an effort. And wear a mask or a facial covering of some sort when we're close to people, and wash our hands as much as possible. And so we need to incorporate infection control as part of our routine lives. So what we need to do is improve things that we did not pay attention to. For example, we can pay attention to the vaccines that already exist. For example, there are pneumonia vaccines for adults and children that I know in India, very few people get them. I know my mom didn't get them. I had to force her to go get the pneumonia vaccine. There were 23 lakh children in India didn't get their measles vaccine. So now would be a good time for us to make sure that our children don't get measles or pneumonia, and our kids and our adults don't get pneumonia. So let's use the vaccines that are already there. It may take years for a good vaccine for it to come and for everybody to get it. And we don't know how long that's going to be. So until that happens, we need to learn how to live safely, but without fear. We can't lock down everything for many, many years. I mean, we will lose our jobs, people will starve, people won't have places to live, children won't have any education. I mean, that may not, think of how that's going to affect them in long term. The mental health is going to greatly suffer. So we just can't shut down everything. We need to figure out new ways, innovative ways in which we can carry on with our lives. Obviously, one thing that we're already doing is doing things remotely, but doing things remotely is not exactly the same as doing things in person. So we will have to slowly figure out what are things that are safe that can be done in person, taking the appropriate safety precautions. And we just simply have to think outside the box for those things to happen. So I'm going to show you another slide here. And this is how we can change our perspective. Just flip the iceberg on its tip. So now the COVID deaths are at the bottom where they should be, because compared to everything else, that is just a small part of our life. So let us focus on the things that we actually have control over. So our change in thoughts can lead to change in feelings, and this will ultimately allow to change our behavior. So what are the things that we can do? We can continue to eat very healthily and improve our nutrition. We can improve our physical activity, because we've already seen that obesity is one of the biggest risk factors in COVID-19 deaths. So if this is going to be around for a few years, then that's plenty of time to really change your diet and your exercise and bring your weight down to a healthier level. We can also make sure that all our adult vaccines are up to date. We can make sure our children go back to school safely. I mean, us middle class and upper class people, you know, our children get fed well regardless of whether they go to school or not. But a lot of the lower class people, they depend on these school meals for their children's nutrition. So we need to get the children back to eating healthily. We need to get the children back to getting their vaccines, their measles vaccines, their pneumonia vaccines, their hepatitis vaccines. We need to teach children and ourselves to make social distancing, hand washing, and face covering a part of our daily lives. And most importantly, we need to find new ways to connect socially and emotionally. Zoom and Teams and things like that, they're just not the same. We have to find ways to connect physically as well. You know, you can still maintain distance from people. You can wear your mask, but let us not lose connections with our family and with our friends. So I hope in talking about this, I have been able to convince you that we can adapt to COVID-19, that we can, you know, we need to stop worrying about things that we have no control over. We have no control over, you know, when the vaccine is going to be discovered, when a new treatment is going to come. I mean, we have no control over that, but we can make changes to things that we do have control over. So a couple of things: we can break the news addiction. We, you know, do not have your news, your TV news channel on all day long, blaring out how COVID-19 is destroying the world. You know, watch news once in the morning or once at night. You don't need to watch news more than once a day. Limit social media. I mean, constantly on Facebook and WhatsApp, there's things, these memes, these figures about how everything is so horrible. You know, we don't need any of that. You know, don't listen to people who have their degrees, their medical degrees from WhatsApp University and from Facebook University. You know, those universities take everybody and they give a gold medal to everybody. Find trusted resources, people that you know are looking at this from a balanced view, that have an expertise to talk about that, and limit your source of information from them. And I hope now that you can look at things from a new angle, from a new perspective, and a new lens. That is my formal presentation today. And before I open it up for questions, I want to thank Dr. Ann Nirmala for initiating and coordinating this program. I also want to thank Dr. Beulah and Dr. Latha and the many others in the various departments that made this possible. And finally, I want to thank the principal, Dr. Christina Singh, for fostering such an event for the faculty. Thank you so much. I am going to ask whoever is coordinating this to go ahead and open the chat box, and I'm willing to take some questions depending on what time I think we do have time here for you to ask me some questions. But I already have 2 questions from faculty that I'm going to talk about while you all are typing your questions. The first question was, let me take a drink of water here if you don't mind. Can we treat COVID-19 if we can't hospitalize the patient? So I don't know if this question was related to the cost of hospitalizing the patient, where they feel like they have to keep the patient home. I'm not sure. But let me say that most people are going to be able to be at home. Remember, 80% of people don't even know that they have the coronavirus. So if you just go get tested and you're positive, you just stay at home because most likely you'll have no symptoms. The people that do have symptoms, so the fever, the cough, maybe the sore throat, the nose, runny nose, feeling tired or achy, those are all things that's just like any other cold or the flu that you can treat at home. You would take some paracetamol to bring the fever down, to help you with your aches and pains. You can use some cough drops, to help you with your cough and your sore throat. And at the same time, you can also, make sure you drink plenty of fluids and get plenty of rest. So you can definitely manage those symptoms at home. But there are some things you absolutely cannot manage at home. And you really, really need to go to the hospital for that, because there's that small percentage of people that get deathly ill from this. So let's say you're managing at home, you're doing pretty well, it's been a few days, and then you get short of breath. That means you're having trouble breathing. You can't take a deep breath, or you can't blow the breath out, or you're having chest pain. You feel like there's some heaviness in the chest. This could mean that you have a pneumonia from COVID-19, or it could mean that you have a blood clot in your lungs from that, or it could be affecting your heart. So these are things that you absolutely cannot manage absolutely cannot manage at home, and have to be taken to the hospital, and should be taken to the hospital early. You don't want to wait until you're struggling for breath. So when you get to the hospital early, then they will be able to treat you better. And the other thing that you need to be very careful about is any neurological symptoms. So if you're feeling confused and you're lethargic and you just don't seem right mentally, those are signs that you may be having some neurological problems from COVID-19. It's very important that you go to the hospital. If money is an issue, it is better to go to like GH or a public hospital. Your chances of survival are much better going to the hospital than staying at home, because you may need to have a breathing machine, you may need to have oxygen, you may need to have blood thinners, and these are all things that you cannot do at home. So I hope I have answered that question. The second question is, is relapse possible? And can you get infected more than once? So far, I think it's our first case was tracked to China in November. It's been 8 months so far. And in those 8 months, we have not had a single confirmed case of reinfection, which is very good news. But that doesn't mean that these people may not get infected 2 or 3 years from now or another year from now. We don't know. But so far, we have not had any reinfection or relapse. There have been several people who have tested positive. They've tested positive first and then negative, and then they become positive again, or they test positive for weeks and sometimes even for months. And some very good studies have now shown us that these positive tests are really viral remnants, RNA remnants, these little bits of virus that are left behind after the infection is over. So these remnants are not capable of creating a new infection. A very nice study from South Korea showed that. So at least for now, we don't have to worry about getting reinfected immediately. So those are the 2 questions that I have. Do we have any questions on chat that I need to address?
There are 2 questions, Sudha.
Oh, okay. I'm looking here at this box. Let me see. I've not used this before. I see. Is it from? Now I think I have. Curious to know why children are spared COVID-19. I think that's a wonderful question that we're all working on right now. We are not sure. What they have found is in, for example, neonates and pregnant women, they have found that these fetuses actually have fewer receptors. So that's one thing. So maybe children have fewer receptors. They have a different immune system. We don't know, but I'd be the first one to let you know when we have those studies. What about the level of contagion in COVID-19? Is it not more harmful than the other diseases? The level of contagion in COVID-19, just like we talked about, it depends on more harmful. It's obviously not as fatal as measles, it's not as fatal as pneumonia. In that sense, it's not as contagious as if you're talking about how infectious it is actually much less infectious than measles, for example, but it's more infectious than flu. So flu is about, R0 is a number that we use, which shows you how many people one person can infect. So for flu, it's 1 to 1. So one person infects one other person. For COVID-19 is about 1 to 1.5. whereas for measles is 1 to 18. So to put things in perspective. So COVID is a little bit worse than flu, but a lot less bad than measles. Whether the COVID-19 is airborne. So that is the question here. What is the COVID-19 airborne? So there are three means of transmission of COVID-19. Predominantly, maximally, the big means of transmission is via droplets. So droplets means you have particles of virus that are suspended in, nasal secretions or mouth secretions, and then they are, fall on somebody else's face or nose, or they touch it and then, go from there. Now, airborne is a possibility. Airborne means where the virus is in tiny little particles, not in microscopic particles that can float long distances. That is possible for sure, but it is not the major mode of transmission. So I personally am, it's beyond our control really. We'll have to be in sort of a hazmat suit to protect ourselves from the airborne particles, which is not practical and is really not needed at this point. The third way of transmission is when we sneeze or cough on something and it lands on a table, and then somebody else goes and touches those droplets, and then they, put their hand on their face, then they can get, or into your nose or mouth, and they can get it from that type of contact transfer. That also happens, but again, not as much as droplet to droplet spread. So you're close to somebody, you sneeze, you cough, you talk, and those droplets go and land on them. That is the number one way of transmission. And that's why we wear face coverings or cloth masks when we are close to each other. If you're very far away from each other, 10 feet away, 6 feet away, whatever, all the droplets are going to fall on the ground before they get to you. But if you are close by, then that could land on you, and that's why we wear the mask. Let me see another thing. Would these help? Here's a question. Would inhalation and breathing exercises help? Now, there have been a lot of things on WhatsApp about this, and really we do not have any evidence that this helps. Obviously, it's not going to hurt, but you need to be careful about if you're doing steaming with other substances. I recently had a consult from India about a patient that was doing, this is something that he saw on WhatsApp apparently, that doing a steam inhalation with turmeric or haldi or manjal as it is called. And so he put a lot of turmeric powder in his steam inhalation pot and ended up getting really, really sick by inhaling a lot of turmeric particles. So please do not do that kind of stuff. Just because turmeric is an antiseptic when it's applied to your skin when you have a cut, or it may have a benefit when eaten, there is nothing to say that turmeric is safe when it's inhaled. In fact, when you inhale foreign bodies like turmeric particles, you can actually do damage to your lungs and to your bronchi, possibly, we don't know. But this person got really, really sick, and I got consulted on this patient. So let's be very, very careful about how we go forward with this, okay? I think that is it. Are there any other questions or anything that we need to, let me see.
There's one more.
How can we build positive thinking among our youth and student community? Thank you for that question. Yes, absolutely. And I hope that I have given you some help today about building positive thinking. And I hope that you can be the teachers now of CBT to your students and to the youth community going forward. Because you have now learned a very, very powerful technique. It may seem to be relatively simple, but I can't tell you how much we use this to change how we think. So CBT is very effective for positive thinking. We can even use this in young people, when they understand things. You can't use it in really little children, but definitely in preteens and teens, we can use this to reframe things, change the perspective. So when a student comes to you and they're like really depressed about what's going on, give them another perspective, show them another piece of data, just like I did today with you. Because my whole thing today was how to make you be positive. Because once you are positive and you see hope in your life, then you can transfer that same hope to your students and to your children at home and other younger people that you come into contact with. What is the best curative, allopathy or Siddha or homeopathy? I really can't answer that because I don't know anything about Siddha or homeopathy. I am an allopathic physician, so I can only talk about allopathy. But regardless of it, it doesn't matter. We need to be careful, and it doesn't matter which of the three systems you use. You need to make sure that these are proven benefits, that we don't take anything that could potentially cause more harm than good. And the other thing is, if you are taking allopathic or Western medication and you want to add homeopathic or Siddha medication, please make sure that you tell your doctor. It's very, very important, because some of these things may interact with each other, and and if you don't tell your doctor, they won't know. So for example, I have patients who are, heart patients that are on all these different medications. They've got heart attacks. They may be on 3 different thinners. And then somebody told them that you can take garlic. It is really good for you. Well, yes, garlic is good for you, but it's good because it may help with your blood thinning. But the problem is garlic interacts with all of these other drugs. Now we're talking about garlic capsules, not just eating a little bit of garlic with your with your food. But in the United States and even in India, I've seen these garlic capsules. So these are alternative medicine. It's herbal, it's natural, but then it can interfere with the drugs that you take, and it can actually increase your risk of bleeding. So you need to be very careful about mixing allopathic and Ayurvedic or any other alternative medication. So don't hesitate to tell your doctor and say, hey, you know what, I'm taking this kashayam or this herb or this something tincture, and I'm taking blood pressure medicines. It's even better that you don't start it on your own. First talk with your doctor and then do that. But in general, it's not a good idea to mix these things because there are no studies. Let's say there is an Ayurvedic herb that you want to take, but you're currently taking diabetes medicine like metformin, or something like that. Then even your doctor won't be able to tell you if it is safe because there's been no study that has been done, where they took 100 people and they gave them just metformin, and another people that they gave them metformin and an Ayurvedic herb to see if there was a problem. There just isn't such a study, so your doctor may not even be able to help you. So short answer, don't mix those things to be safe. All right, let's see. I think we're doing, is that it, or do we have anything else going on? Hello? Hello?
There aren't any more questions in the chat box.
Okay. Is there anything that any of the faculty would like to ask me? I think we have a couple more minutes, or if not, we can wrap it up. All right. Looks like I think we're done. Thank you for your time. It was a wonderful, wonderful session here, and I want to thank you again for being here today. And if you want to read any of my newspaper, magazine, or blog articles, or watch my videos in English or in Tamil, I have a few in Tamil on COVID-19, then please do go ahead and visit my website. It's Sue Royappa. I practice in this country under Sue because nobody can speak pronounce my name, but it's SueRoyappamd.com. And you will find all of my articles there, and everything, everything that I've ever written about COVID-19 is there. And if you have more questions that you think about after this program, then please feel free to submit them to Dr. Ann, and I'm sure, we'll get back to you on that. All right. And again, thank you, Dr. Ann Nirmala. Thank you, Dr. Lata, Dr. Beulah, and Dr. Christina, and all the others who were involved in this program today. It's been an absolute pleasure. Thank you.